Hi, I'm Eileen Karina with Pulse Center for Patient Safety Education and Advocacy, and I'm here with Cathy Bond, a patient advocate and founder of a listening ear based in Stone Mountain, Georgia. And Cathy's going to talk to us a little bit about what she does with a listening ear, and then take us through her role in the Take Charge campaign. Cathy, welcome.
Thanks, Eileen. Thanks for having me. Well, as you said, I am a patient advocate in Stone Mountain, Georgia. I serve Stone Mountain as well as Atlanta and some of the surrounding counties. And what I do is I advocate for senior citizens and their families. When I say advocate, I mean I help my clients have a voice in their patient care. So I help my clients to craft questions that they may want to ask their physicians. I help my client to be calm and make sure that they ask the right questions, even when sometimes a doctor may be in a rush. In addition to that, I also help my clients with their medication list. We reconcile the medication list, especially if they go into the hospital and come out, because we know that time and time again, medications may be added or taken away, that sometimes older adults are not can't remember that were discarded or added. So I make sure that we do that. In addition to that, I talk to my clients about asking their physicians to wash their hands, letting them know when they feel uncomfortable. And I advocate if you feel disrespected in the care you're receiving, get another physician. There's always another physician. And finally, one of the main things that I do is that I set up community services. I make sure my clients are aware that there are other resources, some that are free and some that cost just a minimum, and that they have access to those. And one of the most important things that I do is I sit by their bedsides before coronavirus to make sure that if a doctor came in, I was aware of the medications that they were receiving, making sure that the care that they wanted was communicated to the staff at that particular hospital. So that's what I do. And I actually started doing this because of my mother and my father-in-law. And as I've said before, I am an accidental, on purpose patient advocate. Last year, I'll just go back just a year ago. Last year, I was a Take Charge ambassador. And when I learned about this, I was super excited. I couldn't wait to get started. I thought this is just a great idea because the steps are so simple. So now this year, I went from being an ambassador to a leader in the Take Charge campaign. So I absolutely use this with my clients. I have really to my clients about completing an advance directive, particularly because I deal with older adults. Older adults are not the only ones that need an advance directive. So since I work with their families, I encourage their families to do so. I also encourage anyone that's 18 years of age and older to complete an advance directive. And I actually tell them things that I've learned from you and others that are in this on this committee, on this in this campaign about the stories of a child going to college and the parents not having access. It is important. So I actually do this in my own work and I make sure that they understand. And I take the time to say it in simple terms because Take Charge use simple language.
Cathy, if people want to reach out to you and they're not in Georgia, could you help people who may not be local?
Absolutely. All you have to do, I'm on social media, I'm on LinkedIn as well as Facebook, and you can always call me, and I have a website. Just recently, I went to a senior residence and I asked if I could talk to the residents about the Take Charge campaign. I didn't want to talk to everyone in person. I wanted to do a group setting with social distancing and masks, of course, and I was actually given permission to do so. I left flyers in the lobby and on the elevator. And the day of the event, I had about 15 people that attended. On the flyer, I had the Take Charge campaign, but I promoted the campaign as a Ask Cathy. So what you could do was, once you saw what we were talking about, the 5 steps, You could ask me anything related to those 5 steps. We had the event. I was asked a number of questions. Some were comical and some were very serious. And I feel that being a Take Charge campaign leader equipped me with what I needed to be able to answer those questions. So, needless to say, I left advanced directive paperwork. I helped someone fill that. I helped about 2 people fill their advanced directive out. I talked to some of their family members. I've still been receiving phone calls, and I'm actually planning to do another event. Um, Also asked me about Zoom. As I said to the people that I helped recently, I'm available to do Zoom anytime.
So tell us why you got involved with Take Charge, Kathy.
I got involved with the Tech Charge campaign because I wanted to make sure that people of color, older adults, neighborhood that were not affluent knew about this campaign. It's simple. It is something that we all can do, whether we have millions of dollars, whether we are brown, white, Asian, Native American, Hispanic, it doesn't matter. Good care, good patient safety is universal. That's why I became involved.